Tennis elbow and golfer's elbow are two of the most common causes of elbow pain. While they sound similar, they affect different parts of the elbow and involve different muscle groups. Both are overuse injuries that develop slowly over time and are linked to repetitive motions of the wrist and forearm. Hi, my name is Dr. Mark Gruner. I'm a board-certified sports medicine physician. You want to know how to keep your body healthy and active? Remember to hit subscribe button below. Now let's get into the tennis elbow and how it's different from golfer's elbow. Tennis elbow is also called lateral epicondylitis. It happens when the tendons that attach outside of the elbow become damaged. These tendons belong to the muscles that help extend your wrist and straighten your fingers. Tennis elbow happens from repeated wrist extension and forearm rotation, which can occur not only in tennis players, but also in people who do a lot of manual work, such as carpentry, painting, or excessive typing. Pain is usually felt at the outside part of the elbow and can worsen when you grip objects or lift something with your palm face down. Golfer's elbow is also called medial epicondylitis, and unlike tennis elbow, golfer elbow affects the inner part of the elbow. It happens when the tendons that attach to the inner part of the elbow get injured or degenerate or torn from overuse. Pain appears on the inside of the elbow and usually gets worse when you flex your wrist or pronate, which means rotate your arm. And it happens in sports such as swinging a golf club or throwing a ball. The biggest difference between the two conditions is their location and muscle groups. Tennis elbow affects on the outer side of the elbow. It affects the tendons that are responsible for extending the wrist, while golfer's elbow affects the tendons on the inner elbow, and it's responsible for the tendons that flex the wrist. Both are most common in adults between 40 and 60 and can occur in athletes, manual laborers, or anyone who's performing repetitive activities. Risk factors include high physical workload, obesity, smoking, or poor ergonomics at their workstation. Diagnosis is usually made through a physical exam. Your doctor will ask about your activities and check for tenderness at either the outer or inner part of the elbow. Pain that worsens with certain wrist or forearm movements help confirm the diagnosis. Imaging tests like ultrasound or MRI are only needed if symptoms are unusual and symptoms have persisted. Ultrasound, which can be performed in the office in conjunction with a physical exam, can be very beneficial to identifying if there is a tear in the tendon. Treatment for both tennis elbow and golfer's elbow start with simple non-surgical approaches. The first step is activity modification, resting the arm and avoiding motions that trigger pain. Secondly, physical therapy can help to strengthen the muscles around the elbow, improving flexibility and strength and correcting poor movement patterns. Pain relief for both golfer's elbow and tennis elbow can come from anti-inflammatory medication. While cortisone injections may give short-term relief, they are not recommended for tennis or golfer's elbow because they can delay healing and increase the chance of reoccurrence. Other treatments, such as meeting with a physical therapist who might do dry needling or shockwave therapy, which can be done in a physician's office, can also be considered. If this does not work, there are minimally invasive treatments that can help. The two treatments considered are a percutaneous tenotomy using a device called Tenex that focuses on making a small little incision in the elbow, removing the injured tissue while preserving the normal tissue. Or another injection is called PRP. And PRP is where we'll do a small tenotomy with platelet-rich plasma, which is a concentrated dose of platelets that come from your blood and release growth factors which help repair injured tendons. Surgery is rarely needed to either condition, but can also be an option for patients who have persistent pain that interfere with their life, despite therapy and some of these other treatments. In summary, tennis elbow and golfer's elbow are both overuse injuries that affect tendons around the elbow, but on opposite sides of the elbow. Tennis elbow involves the outer part of the elbow and affects the wrist extensors, while the golfer's elbow involves the inner part of the elbow and affects the wrist flexors. What questions do you have about these two conditions? Drop them in the comments below, and I will try to answer them in a future video. Hope you found this helpful. Remember to hit like and subscribe below, and I will see you in the next video.